Well, it's been a year since the Food and Drug Administration drafted a ban of menthol cigarettes and flavored cigars. Researchers with the FDA say a menthol ban would save more than 500,000 lives within the next 40 years. And a recent report by the Council on Foreign Relations finds the ban would eliminate disparities in lung cancer death rates between Black Americans and other racial groups within 5 years. Right now, lung cancer, the leading cause of cancer deaths among the Black community. Dr. Philip Gardner and Dr. Sylvia Gates Carlisle joining us live this morning with more on how this ban will combat racial health disparities and help save lives. It's good to have you both with us this morning.
Thank you. Thank you.
Thank you for having us.
So, doctors, how has the tobacco industry targeted minority groups and kids with their marketing for menthol cigarettes?
Well, the tobacco industry has effectively targeted minority communities in their advertising, pricing, and the programs they support, be it music programs that people want to participate in. So they've targeted the community because they want to sell their product.
So what is it about menthol cigarettes that make it easier for kids to start smoking and harder to quit?
I mean, menthol by definition is an anesthetic. It has a numbing effect and it allows deeper inhalation. The deeper you inhale, the more toxins you take in. The more toxins and nicotine you take in, the more addicted you become. The more addicted you become, the harder it is to quit. That's why they put it in there. And it's the flavor of menthol. And the other thousands of flavors that are out there with vape products and other flavored cigarettes that attracts kids. It makes it easier. The punchline, it allows the poison to go down easier.
What do we know about e-cigarettes at this point? I mean, is there enough research to indicate that it's dangerous? Because when it was first marketed, it was saying this is a way you can, try to quit smoking.
There's never been any evidence that e-cigarettes were substantially different from traditional cigarettes. They have nicotine, they have tars, and so the hope that e-cigarettes would somehow be safer, quote unquote, has never been proven. Okay, and so now it's time for us to act on what's been known since the 1940s about the dangers of cigarettes to not only lung cancers, but multiple other cancers and health conditions.
So the FDA expected to issue final regulations on a menthol cigarette ban later this year. So what can cities and states do in the meantime to protect targeted communities?
I would suggest that we can't wait on the FDA. The FDA had the chance in 2009 when it outlawed 13 other flavored cigarette products. It kept menthol on the market. It wasn't until 2020 when my group, the African American Tobacco Control Leadership Council, sued the FDA that they actually finally moved on it. And even though they say they're going to proclamate the rule in August of this year, it's probably going to take longer. So what my group has done and others have done, we've encouraged cities to take this up. Some 90 cities around the country have adopted menthol restrictions. Some other 150 or so have other flavor restrictions. And we know the state of California recently did this. State of Massachusetts did it in 2020. This is being considered in Oregon in the legislature as we speak. They are meeting on this this spring. We would encourage the state of Washington to take this up too. We have tried to do this in locales there. They've been told that because of preemption in Washington, it would need to be done at the state level. We would encourage the state of Washington to take this up. There are many tobacco control folks there that are willing to do that.
And this is an issue we will continue to follow closely. Dr. Philip Gardner and Dr. Sylvia Gates Carlisle, thanks so much for joining us this morning. We appreciate it.